So now we begin our wonderful adventure of learning about the brain. Brain is one of my favorite topics, and in Module 5 we'll be talking about neural and hormonal systems, talking about the basic structure of the nervous system, and then going into some of the details of the endocrine system. So for Module 5, we'll be talking about the building blocks of the mind, neurons, and how they communicate. They communicate through neurotransmitters, sending neurotransmitters to adjacent neurons. Systems that build up the mind, functions of the parts of the nervous system. So I'll talk about the sympathetic and the parasympathetic division of the autonomic nervous system and contrast that with the central nervous system. And then I'll be talking about the supporting player, the slower communicating endocrine system that relies on hormones. So neurotransmitters are very quick and hormones are very slow in terms of communication. It all started studying of the brain connection with the pseudoscience field of phrenology. At the time, in the early 1800s, phrenology, developed by Franz Gall, was the study of bumps on the skull and their relationship to the mental abilities and character traits. And phrenology was taken seriously, so you can feel someone's bumps on their skull, and you can figure out what their personality is like, what they dislike. Are they very emotional people? Are they very logical people, mathematical, etc.? So you can try this at home with your friends and your family. Feel the bumps in their skull and tell them that you're actually gonna figure out what they're good at in their lives. And obviously, this is a pseudoscience field. I mean, this was disproved. And if you look at MRI pictures of the brain, you see the entire brain light up, not just certain brain areas. So, any kind of behavior is relying on a distributed process across the brain in multiple brain areas, not in one little brain area. But years ago, there was also this idea of grandmother cell, that there were cells in your brain that were responsible, a single cell responsible for the image of your grandmother. Obviously, that's not the case today, but there's still some localization of function in the brain, and there's some people that believe more in localization or whatnot. But the way we look at the brain today is that every behavior, every thought is distributed throughout the entire brain. Multiple brain areas are activated. The one good thing about phrenology is that it brought us the attention to the localization of function. So the lobes of the brain have localized functions. Even the right and left hemisphere of the brain have localized functions. So there is an important aspect of this, but it's too simplistic to say that one part of the brain is solely responsible for one activity. So today, researchers that study the brain are called biological psychologists, and that includes neuroscience, behavioral genetics, looking at genetic influence on behavior, neuroscience, obviously looking at function of brain, neuropsychology, which deals with brain damage a lot of times and testing, and evolutionary psychology. All of these subspecialties explore different aspects of how the nature of mind and behavior is rooted in our biological heritage. Our study of the biology of the mind begins with the atoms of the mind, the smallest units of the nervous system, and they are called neurons. And this is a really important image because it shows the various functions of the neuron, the structure and the function of the different parts of the neuron. As you can see, the cell body contains all the organelles, right, including the mitochondria, etc., the energy-producing organelles that fuel the function of the neuron. Cell body is also referred to as soma, S-O-M-A. You can see the dendrites branching out and receiving messages from other cells. So the function of the dendrites, and there's multiple short projections that are sort of branching out from the cell body or soma. The dendrites always receive signals from other neurons. And these signals are communicated through neurotransmitters. And you see this long projection coming from the cell body all the way down to the end, and you see it's covered with this whitish sheath covering called the myelin sheath. And that long singular projection is called an axon. and axons send messages to other neurons. So they pass the electrochemical signal from the cell body or soma all the way down the long projection called an axon. There's only one projection and there's multiple dendrites. And once the electrochemical signal reaches the end or the terminal branches of the axon, neurotransmitters are released. And then they communicate to dendrites of adjacent neurons. Covering this long axon is a myelin sheath. The myelin sheath speeds up neural transmission. And you could think of the signal kind of jumping down the axon, so it goes really, really quickly. However, if the myelin sheath is not intact, if it's been deteriorated or destroyed, then the signal becomes very, very slow. So think of the myelin sheath as kind of an insulation to a cable or insulation to a wire. The insulation of a cable protects the degradation or prevents the degradation of the signal down the wire. And the same thing holds for the myelin sheath. It prevents the degradation of the signal down the axon, the electrochemical signal. In some diseases like multiple sclerosis, the myelin sheath is actually attacked and destroyed by the immune system. And you see as a result in cases of multiple sclerosis or MS, people have very disjointed movement, trouble moving, muscle spasms, problems with muscle contraction. In severe cases, they cannot walk because muscle contraction is disturbed so badly. They tend to have painful muscle spasms, especially in the rib cage, the intercostal muscles, where they feel that they can't breathe. That's referred to as the MS hug. And so it's a very difficult condition to live with, and it's a relapsing remitting disease, MS, that gets progressively worse over time. So that's mainly the function of the myelin sheath, to keep neurotransmission constant and very rapid, and to ensure the muscles are coordinating with each other. There are billions of neurons or nerve cells throughout the body. And I'll be going into more depth into how neurons communicate with other neurons. So what happens is when the neuron receives signals from other neurons, and those signals are received by the dendrites, right? Some of those signals are telling the neuron to fire, and some of those signals are telling the neuron not to fire. So the dendrite picks up neurotransmitter or neuron signals from adjacent neurons, and some of those neurotransmitters are excitatory and they tell the neuron to fire, and other ones of those signals, or other neurotransmitters are inhibitory and they tell the neuron not to fire, to stay at rest. And you want sometimes for the neuron to stay at rest. For example, you want to go to sleep. You don't want your muscles contracting wildly. You don't want your thought processes to be out of control, because then you won't be able to sleep. So when you want to sleep or relax, you want neurons to stay at rest. So you want inhibition. You want inhibitory neurotransmitters to be binding to the dendrites, right? And sometimes you want the neurons to be firing. So if you need muscles to contract, especially if you're engaging in a sport that requires quick decision making or an activity that requires complex muscle movements, you need constant excitatory neurotransmission. However, we usually have a mix of both excitatory and inhibitory neurotransmitters. The goal to allow the neuron to fire is for you to receive more excitatory compared to inhibitory neurotransmitters. So if on balance you have more excitatory neurotransmitters binding to dendrites than inhibitory neurotransmitters, you're going to reach a threshold, right? And once you reach this threshold, the neuron then will fire an action potential. An action potential is an electrochemical signal that sends its signal down the axon and to the axon terminals, which then release neurotransmitters, and the whole process starts all over again. Technically, it's called a depolarization because the inside of the neuron is becoming less negative. And there's a differential between the inside and the outside of the neuron in terms of charged particles or ions. And we're not going to go into it too much, but basically the inside becomes more negative in nature. It's depolarization, and then the neuron fires an action potential down the axon. Like a gun, the neuron either fires or it doesn't fire. So once you reach that potential, that threshold, I should say, the action potential is fired. But if you don't reach that threshold, the action potential never occurs. So it's kind of like all or none response like a gun. If you put enough pressure on the trigger, the gun will fire. You can't stop it. And if you don't put enough pressure, the gun will not fire. So this is an all or none response. The action potential then travels down the axon from the cell body to the terminal branches. And once it reaches the terminal branches, neurotransmitters are then released into a space called the synapse. So there's an empty space between the axon terminal of one neuron and the dendrite of an adjacent neuron. That empty space is called the synapse. The neurotransmitters kind of float around in the synapse and they bind to receptor sites on the adjacent dendrite. And then that either creates an excitatory action potential or it's inhibitory and the action potential doesn't occur. And this is happening millions, if not billions of times a second. So right now when you're watching this lecture, you're having millions of action potentials going on right now that you're totally unaware of. Here's a look at the synapse. So the action potential goes down the axon. As you can see here, you have the axon terminal, and you see those little dots in the vesicles, right? Those little dots are neurotransmitters. They're either excitatory or inhibitory in nature. So once the action potential reaches the axon terminal, those neurotransmitters then get released into the synaptic gap or the synapse. And that's the empty space between the axon terminal of one neuron and the dendrite of the adjacent neuron. If you look at the dendrite of the adjacent neuron, you see a bunch of empty spaces there on the surface. And you see neurotransmitters binding to those empty spaces. Those are receptor sites. And each neurotransmitter has its own receptor site that it can uniquely fit or bind to. If this neurotransmitter binding is excitatory, an excitatory neurotransmitter, then that adjacent neuron is going to fire an action potential. But if the neurotransmitter that is binding is inhibitory, then that neuron that the neurotransmitter is binding to is not going to fire an action potential. So we're really looking at the balance of excitatory versus inhibitory neurotransmitters. As you can see here, neurotransmitters are diffusing into the synapse and then binding to receptor sites where they're having either an excitatory or inhibitory effect. Now, the brain and the nervous system is environmentally conscious because they don't want to waste any of these excess neurotransmitters. As a result, any neurotransmitter in the synapse that does not bind to dendritic receptor sites on an adjacent neuron will get recycled. This process of recycling neurotransmitters is called reuptake. These neurotransmitters are taken back up into the the axon terminal, I should say, and they're repackaged for later use. So the nervous system kind of conserves neurotransmitters, and this may be a good thing, but this also may be a bad thing in some cases. So let's say, for example, you're depressed, and one of the neurotransmitters that we'll be talking about, serotonin, elevates our mood, right? It's responsible for keeping us not depressed and in some ways not anxious as well. And let's say that you don't have enough serotonin that's binding to your receptor sites in areas of the brain that are highly concentrated in serotonin, like the raphe nucleus. So if you don't have enough serotonin binding to receptor sites, you might end up depressed. And if you're depressed, the whole idea is to increase serotonin in your brain to elevate your mood and make you less depressed. And we do that by taking drugs, antidepressants to be more specific. And yes, I always come back to antidepressants because I'm more of a clinical health psych person in nature, and I'm always coming back to this. And I find antidepressants interesting. Antidepressants increase the amount of serotonin that is binding to the receptor sites. As you can see in the picture in the slide, you have some excess serotonin in the synapse, right, in that synaptic gap, and it's being repackaged. It's being reprocessed and put back in the axon terminal. What antidepressants do is they prevent the recycling of serotonin. So if the antidepressant blocks the recycling of serotonin, then more serotonin is available in the synaptic gap, and eventually more serotonin will bind to the dendritic receptor sites once those receptor sites open up again. And so if more serotonin then binds to the receptor sites in the dendrite, then serotonin is having a greater effect in the brain. And most specifically, the SSRI drugs, the selective serotonin reuptake inhibitor drugs, like Zoloft or Paxil or Prozac, Lexapro, these drugs prevent the recycling or the reuptake of serotonin, and they allow serotonin to kind of sit and kind of wait and hang out in the synaptic space or synaptic gap. And eventually those serotonin neurotransmitters that are kind of waiting will then bind to empty receptor sites on the dendrite. And therefore, serotonin is having a greater influence on the entire brain, and it's elevating your mood. Now, the downside of this is that you can end up with side effects because serotonin's not only in your brain. There's a lot of serotonin in your gut, in your GI tract, in your intestines. And as a result, some of the side effects of these SSRI drugs, selective serotonin reuptake inhibitor drugs, are diarrhea, constipation, nausea, vomiting, because of the activity of serotonin in the GI tract as well. These drugs don't just target brain serotonin, they target serotonin throughout the entire body. This is a summary slide showing the effects of creating an action potential and how the action potential goes down the axon of a neuron, and then that axon terminal releases neurotransmitters into the synapse, and those neurotransmitters either bind to receptor sites or they get recycled. And this is kind of just a review of what we just talked about, but this is a very important slide to know, so please study this slide and know the different steps going from an action potential, or from dendrites, from neurotransmitters binding to dendrites and then causing an action potential, to the reuptake or the recycling of the neurotransmitter. So now I'm going to discuss several different types of neurotransmitters and their functions. Serotonin, which affects mood, hunger, sleep, and arousal. As I was mentioning, serotonin is involved in depression. It's also involved in anxiety. Lack of serotonin is especially linked to depression, and these SSRI drugs, the selective serotonin reuptake inhibitor drugs, raise levels of serotonin in the brain and in the rest of the body. Now, serotonin, as I mentioned, has effects in the GI tract, but serotonin also can have an effect in terms of hunger and arousal. So one of the side effects of these SSRI drugs is increase in appetite or GI-related concerns. Another side effect is a decrease in sexual arousal. And these drugs have been used off-label as drugs to treat premature ejaculation in some cases, because they decrease your sensitivity and decrease your levels of sexual arousal. And Lexapro tends to be number one on this list in terms of its effect on killing people's libido. And that's one of the reasons why people stop taking these drugs, is it just basically makes their libido out to be zero. Dopamine. Dopamine is the reward neurotransmitter. I should say serotonin before is excitatory, mostly excitatory, but it can be inhibitory. Dopamine is excitatory. It's involved in movement. It's also involved in learning, attention, emotion, and of course, reward processes. Dopamine is the addiction neurotransmitter. Anything that's rewarding causes a change or an increase in dopamine. and that makes the behavior reinforcing, whether that be drug addiction, pathological gambling, sex addiction, etc., food addiction, anything that that you really want to engage in, any kind of behavior, probably involves a release of dopamine. Oversupply of dopamine, too much dopamine, is linked to schizophrenia. Schizophrenia is a mental condition or psychological disorder where people have delusions, which are false beliefs, beliefs that are not true or not bound by reality. And they also have hallucinations, where they have visual or auditory disturbances. So they see things that aren't there, or they hear voices that aren't real. And the delusion could be a false belief, like they think they're Jesus Christ or Napoleon or Joan of Arc or some famous or mythological character. Obviously, you can't convince them that they're wrong because they don't believe you. They actually experience this world in this distorted way. And it's thought to be because they have too much dopamine. And one way we can kind of test this idea is look at other people that aren't schizophrenic, but that occasionally end up with an overdose of dopamine or too much or an excess of dopamine. And those people are drug addicts. So they end up, a lot of times people are using methamphetamine or cocaine or crack, and they end up in the ER, in the emergency room, and they're screaming that someone's coming to get them. And they're extremely paranoid, and these are paranoid delusions. And once the drug leaves their system, they go back to normal and they're released from the hospital. But drugs increase dopamine, and it can in some cases lead to schizophrenic-like symptoms. Undersupply of dopamine is linked to tremors, decreased mobility, and Parkinson's disease and ADHD. Parkinson's disease is a movement disorder where a person with Parkinson, like Michael J. Fox, the famous actor who had early onset Parkinson's, cannot control the movement of parts of their body. And so you see them shaking their limbs, shaking their hands, etc. And they have great difficulty controlling their movement. And one of the treatments for Parkinson's is a drug called L-Dopa, which then becomes dopamine once you ingest the drug. And that dopamine decreases the effect of Parkinson's. They also do stem cell implantation into dopamine-rich areas of the brain to decrease the movement effects or movement disorder associated with Parkinson's disease. Another side effect of treating schizophrenia, which is excess dopamine, is you give drugs to treat the schizophrenia. These drugs are called antipsychotics or neuroleptics. And you give that drug and it stops the hallucinations and delusions by blocking dopamine. The problem is it induces a pseudo-Parkinson-like state. The pseudo-Parkinson-like state is called tardive dyskinesia. And what happens in this state is that people have trouble moving at all. They can't move. It slows them down. It makes them feel horribly. And that's why a lot of schizophrenics don't want to take their medication, because it blocks too much dopamine and it basically causes them to have problems moving around. The next neurotransmitter, which is also excitatory, is acetylcholine, and this is involved in muscle contraction and memory. In Alzheimer's disease, the acetylcholine-producing neurons degenerate, and as a result, Alzheimer's patients have trouble forming new memories, and some of their established memories will deteriorate as well. Acetylcholine is involved in muscle contraction, and that's important because in some cases there's too much muscle contraction, and you need to block acetylcholine to stop the muscle spasm or the muscle contraction. And we'll talk about that when I get to agonist-antagonist. Norepinephrine is also an excitatory neurotransmitter. This is involved in alertness, arousal. It's also been linked to depression and modulating pain. So too little norepinephrine, it depresses mood, and it causes ADHD-like attention problems. So drugs that are used to treat ADHD, like Ritalin and Adderall, increase norepinephrine and therefore increase the attention span of children, mainly children with ADHD. There's a small percentage of adults that have ADHD, but it's a majority of children. Norepinephrine is also involved in pain regulation. So there are drugs that regulate norepinephrine and serotonin. They're called SNRIs or NSRIs. These are serotonin and norepinephrine reuptake inhibitors, and they prevent the recycling or the reuptake of both norepinephrine and serotonin. These drugs include drugs like Cymbalta and Effexor. And you may have seen the marketing advertisements for Cymbalta, where it says depression hurts, Cymbalta can help. And there's an effect of norepinephrine on pain regulation. So these drugs that target norepinephrine and prevent the reuptake of norepinephrine increase levels of norepinephrine in the brain and decrease the perception of pain. So Cymbalta has been used, I guess, off-label. Maybe it's on-label now, for treatment for painful musculoskeletal conditions like fibromyalgia, a disorder where the muscles ache and constant pain that predominantly occurs in women. And it really has no organic basis or no medical cause, but these drugs that target norepinephrine tend to help with the pain of these conditions. GABA is your major inhibitory neurotransmitter, so this is what slows you down. GABA increases when you need to go to sleep or when you need to relax, right? And if you don't have enough GABA, you could have anxiety. In severe cases, you can have tremor. In really, really severe cases, you can have a seizure if you had a significant decrease in levels of GABA in the brain. But as GABA increases, muscles relax, thoughts slow, you become in a very relaxed state, and sleep is induced. So GABA is the major neurotransmitter throughout the body. And finally, glutamate, which is a major excitatory neurotransmitter, and this is involved in memory. However, some people are very sensitive to oversupplies of glutamate. So some people struggle eating food that is cooked with monosodium glutamate, or MSG. Monosodium glutamate directly increases levels of glutamate in the brain, and although glutamate is important for memory, some people are very sensitive to increases in glutamate, and they may develop migraine headaches, in very rare cases seizures, but mostly migraine headaches due to the ingestion of these foods like MSG that increase levels of glutamate in the brain. So there are different pathways that rely on serotonin and dopamine. Some of the serotonin pathways include the raphe nucleus. That's the major serotonin center of the brain, and so if you're trying to increase serotonin, you're targeting the raphe nucleus. Raphe is R-A-P-H-E nucleus. And major dopamine pathway in the brain is the nucleus accumbens. Nucleus A-C-C-U-M-B-E-N-S. Nucleus accumbens. And that's the major reward center of the brain, and a lot of dopamine is stored there. So how do neurotransmitters activate receptors? Well, neurotransmitters bind to receptor sites on dendrites like a key fits into a lock. So each neurotransmitter molecule has a specific shape, and it binds exactly to only one type of receptor site. And once that neurotransmitter binds to that receptor site, it can either have a positive effect or a negative effect. I mean, sometimes the neurotransmitter is excitatory, sometimes it's inhibitory, right? But sometimes certain substances can boost the effect of neurotransmitters, and sometimes certain substances can decrease the effect of neurotransmitters. And this brings me to the idea of agonist and antagonist. So any substance or drug that increases the effect of a neurotransmitter is called an agonist, and any substance or drug that decreases the effect of a neurotransmitter is called an antagonist. So if you look at the various neurotransmitters, an SSRI, a selective serotonin reuptake inhibitor that I mentioned before, would be considered a serotonin agonist. A drug that increases dopamine, so a drug for Parkinson's disease, could be considered a dopamine agonist. So that drug could be L-Dopa or some analog of it. A drug that increases GABA, so a drug that relaxes you, like a Xanax or a Valium or a Klonopin or Ativan. These drugs are all GABA agonists. They're also known as benzodiazepines or benzos for short. And then you also have antagonists, drugs that block the effect of a particular drug. So in the case of dopamine, if you want to block dopamine, like you do when you have a schizophrenic patient or a psychotic patient, you would give a drug to block dopamine, a antipsychotic drug, or what is called a neuroleptic drug. Some of the older ones that are still used today include Haldol or Thorazine, and they block the effect of dopamine at the receptor site, and they are dopamine antagonists. Sometimes you want to block the effect of acetylcholine because acetylcholine causes muscle contraction. What happens when you contract muscles in your face? Eventually, over many decades of life, if you keep contracting muscles in your face, you form creases and eventually wrinkles. If you want to smooth out the crease or smooth out the wrinkle, you've got to stop the muscle from contracting. Stop the muscle from contracting, you need something to block acetylcholine, an acetylcholine antagonist. One very famous example or commonly used example is botulinum toxin or Botox. Botulinum toxin is poison, and when you inject Botox or botulinum toxin into a muscle, it paralyzes the muscle. In the case of wrinkles, it paralyzes the muscle and smooths out the wrinkle for about 3 months, then you need to repeat it again. But in the case of medical procedures, when you want to stop muscles contracting, or you want to stop the effect of acetylcholine, you could inject Botox. So if you have a chronic muscle spasm, Botox will help. It helps greatly with migraine headaches. You inject Botox into the scalp, into the side of the head, into the neck, which are common trigger points or common points where the migraine is referenced from, right? And you stop those muscles from contracting, and you actually stop the headache. Or you inject Botox in underneath the arm where someone's sweating excessively and it paralyzes the sweat glands. Or you can inject Botox, into someone who's suffering from anal fissure so that you stop the anal contraction and the muscle relaxes and is able to heal. So there's many medical conditions where you can use Botox, and Botox blocks the effect of acetylcholine. It's an acetylcholine antagonist. So those are just some examples of drugs that are agonists or antagonists. Now moving on to the nervous system. And the nervous system is composed of two major divisions: the central nervous system, which is the brain and the spinal cord, and the peripheral nervous system, which is everything else, everything that's all the nerves that branch out from the brain and the spinal cord to the other muscles and glands of the body. When you think about nerves, you should say, think of nerves as bundles of neurons. So if you bundle the axons of neurons together, if you bundle enough axons, you'll form a nerve. And the more axons bundled, the bigger the nerve you form. So you can think of nerves like threads that make up a rope. You need many, many threads to make up, the fibers of a rope. And you need many, many axons to make up the component of a nerve. Nerves are part of the peripheral nervous system. They connect muscles, glands, and sense organs to the central nervous system, which is the brain and the spinal cord. So here's a look at the parts of the nervous system. As I mentioned before, you have peripheral and central nervous system. The peripheral nervous system is further divided into the autonomic and the somatic division. Autonomic controls self-regulated actions of internal organs and glands, and somatic controls voluntary movements of skeletal muscle. The autonomic nervous system is further divided into sympathetic and parasympathetic divisions. Here's the autonomic nervous system. The sympathetic division is involved in fight or flight. and the parasympathetic division is involved in rest and digest. So the sympathetic nervous system speeds you up, the parasympathetic nervous system slows you down. And the various components that it has an effect on include the eye. So the sympathetic nervous system dilates the pupil so more light is able to enter the eye. This benefits you in low lighting conditions or nighttime vision. Speeds up your heart rate, inhibits your digestion. So if you think about having a heavy meal and then being really nervous, it just kind of sits in your stomach like an anchor. It causes glucose to be released by the liver. Glucose is, blood sugar. It's energy, so that you can act, so that you can run or you can fight the danger that you're presented with. The adrenal gland becomes very active, and it simulates epinephrine and norepinephrine, which is adrenaline and noradrenaline. And the parasympathetic nervous system does the opposite. It slows things down. It contracts your pupil. It slows your heart rate. It stimulates digestion, so it's always good to eat that full meal when you're really relaxed, because that's when digestion is stimulated. It causes the gallbladder to secrete bile to help with the digestion of fats. And so these two divisions really work opposite of each other, and they balance each other out. The sympathetic speeds it up, parasympathetic slows you down. A mind of its own. Here's the endocrine system. The endocrine system is the slow system, releasing hormones. And hormones don't bind to receptor sites, but they exert their effects locally. And I'm going to go through various parts of the endocrine system. The hypothalamus is a brain structure that controls the entire endocrine system. The hypothalamus also controls regulating body temperature and regulating appetite and sexual drive to a degree. The hypothalamus controls the entire endocrine system by directly altering the function of the pituitary gland. And the pituitary gland is known as the master gland of the endocrine system. Pituitary gland controls every other gland. You have your thyroid gland, which is involved in secreting thyroid hormone, and this affects metabolism. So if you have too little thyroid hormone, you're hypothyroid. You have hypothyroidism, and you tend to gain weight. You tend to be low on energy, somewhat depressed. Tend to be very cold much of the time. If you have too much thyroid gland, you have hyperthyroidism, and you tend to be very anxious. You tend to not be able to sit still, have sleep difficulties, and burn a lot of calories really quickly. The parathyroid gland is a gland of the endocrine system that doesn't get much attention, but it regulates calcium levels in the blood. And if you have too much parathyroid activity, you have too much calcium. And if you have too much calcium, you end up with a very painful and dreaded condition. And I've been there before, and that's the dreaded kidney stone. And the kidney stone's going to be a nightmare. I mean, personally, it was just a disaster. I was in the hospital, had to have surgery. Our bodies are not meant to pass through these big crystals in our bladder, basically. And these crystals are made of calcium. If you have excess calcium, you put yourself at risk for a kidney stone. If you have too little calcium, it's not good either, because you weaken the bones, and as you get older, you may end up with osteoporosis. And this is very common with pregnant women, because their babies are sucking all the calcium out of their blood, and so pregnant women have a higher chance of developing osteoporosis, especially earlier in life. The adrenal glands are part of the fight or flight response. This is your adrenaline. In very rare cases, you can have a tumor of an adrenal gland, something called a pheochromocytoma, and you produce so much adrenaline that your blood pressure skyrockets, and it's a very dangerous situation. But it's a very rare condition. The pancreas is responsible for regulating glucose or blood sugar. In the case of diabetes, you do not produce enough insulin from the pancreas. The pancreas does not produce enough insulin, and therefore you cannot regulate the level of blood sugar that you have, and your sugar goes very high. So you need to take artificial insulin, or you have to take other medication that that basically helps the pancreas work more efficiently. And then you have your sex glands, your testes, the male sex hormone secreting testosterone, and the ovaries, which secrete estrogen, progesterone. The endocrine system is really slow because it sends hormones through the bloodstream instead of across synapses. So it's a very slow moving system. These signals are hormones. So the endocrine system produces hormones, and these hormones go to the brain and other tissues throughout the body and exert their effect. But neurotransmitters are a matter of milliseconds, and hormones are a matter of seconds. So it's multiple times as slow as neurotransmitters. As I mentioned before, the adrenal glands involved in fight or flight, they lay on top of the kidneys. They release adrenaline and noradrenaline. This increases heart rate, blood pressure, blood sugar, and gives you energy. So that when the adrenals kick in, you're able to escape or you're able to fight the danger that lies ahead. The pituitary gland is the master gland, and it regulates all the other glands of the endocrine system. It's controlled by the hypothalamus, as I mentioned previously. The pituitary gland also produces its own hormones. It produces growth hormone, and the growth hormone is released during deep sleep, what's technically called non-REM 3 sleep. And growth hormone is important in the repairing the damage to your body, so the wear and tear of the day's events. You feel beat up at the end of the day, you get a good night's sleep, you feel better. And the reason you feel better is because the pituitary gland is secreting growth hormone. And it reverses the damage done to the tissues and to some degree to bone, but mostly to tissues, right? To muscles and other tissues in the body that are damaged through the wear and tear of the normal day's events. Growth hormones used by athletes illegally to rejuvenate themselves. So as athletes get older, they get more worn down and they feel the aches and the pains and they can't produce at a high level because they're just exhausted and their body hurts. When they take growth hormone, they turn back the clock 10 to 20 years. Their body's able to bounce back from the wear and tear of playing a sport, and it gives them an undue advantage. And so growth hormone is prohibited in the Olympics and also in many sporting leagues around the world. Oxytocin is also secreted by the pituitary gland, and oxytocin is responsible for bonding, the bonding hormone. And so if you secrete oxytocin when you give birth, you bond with your child. If you secrete oxytocin when you're having a relationship with your partner, i.e., sex with your partner, you form a connection with them afterwards through the release of oxytocin. So oxytocin helps us bond with both partners and with children, or infants, I should say.